Dr. Serkan Aygın from Istanbul, Turkey. I'm a dermatologist. I'm 56 years old and I've been working in this field, hair transplant field, for 26 years. After I became a dermatologist specialist, I personally care of hair treatments, and then I started to do this operation 26 years ago. We used to perform surgical methods, strip methods, and we used to cut the skin, some part of skin, and then we used to suture this area. It was real surgery, and for some time we performed this method until the early 2000. 2003, it was a new beginning for the hair transplant. A new method came to the market after this surgical strip method, and we used to strip method, and we used to cut the skin, some part of skin, and methods came to the market. We started to do this procedure 2003, 2004, a long time ago, and then in Turkey we had this chance. We insisted of performing this method. We never gave up. We never gave up. In the beginning, of course, we had some problems after the surgical operation. First few years, we had some, how can I say, some unwanted results. Of course, we didn't have enough experience that time. I'm talking about between 2003, 2007, 2008, and in time, we insisted of performing FUE, follicular unit extraction, and we increased the experience day by day, month by month, and we never came back to the strip method, surgical method. What difference between Turkey and other countries, European countries, United States? Until recently, the clinics in Europe, especially in Spain, in Italy, in Germany, the clinics in the United States, and in the East Asia countries, in Thailand, in Taiwan, of course, until recently, they perform only the old methods, surgical methods, strip method, FUT. But we started much more earlier for the new one, and we increased our experience year by year, and we got a lot of innovations, of course. And after some time, a modification of this non-surgical FUE methods came to market. We call it DHI. DHI provides some benefits, some advantages for us. What's the DHI? What difference from a classical FUE method? In DHI, we have been using much more thinner, much more sensitive equipments, thinner, smaller diameter tips during the extraction, during the implantation, and it provides much more better, much more dense, and much more natural results in time. I'm talking about DHI method. In time, of course, a lot of foreigners from European countries, from United States, everywhere, almost everywhere, many patients came to Turkey for this operation, and they experienced this new methods, very comfortable methods, not painful as before as the surgical one. Sometime we started to use sedation. I call it the pseudo-analgesia. 6-7 years ago, we used to perform pseudo-analgesia. During the operation, patients completely consciously. He's not sleeping, he's awake, he's cooperated, he's eating something, he's drinking something, of course, he's going to the toilet if necessary. This operation takes time. This operation takes minimum 6 hours, sometimes up to 8-9 hours. Very long procedure, of course, and the patients needed some things and always consciously, but thanks to the pseudo-analgesia, he never feels any pain. You know, classical Beckett is not our only donor part. This is primary, the main donor part, and we take most of grafts from the Beckett. But body hair, I'm talking about body hair transplantation. What is the body hair transplantation? We are using some grafts, some hair from other parts. Which one? The beard area under the chin. And for some patients, they have very, very strong chest hair. We are taking from chest as well. We have 3 different donor parts, mainly back head and beard and chest, of course. And all this procedure is being done under pseudo-analgesia, when a patient doesn't feel any pain during this long time. And even after operation, patients don't have any pain, and mostly they need only 1 painkiller or maybe nothing, 0. And in time, of course, 80–90% of patients are from different countries, and follow-up process becoming much more important. People are having operation and they're going back home, and of course after the operation we expect some process. This is a process, we inform them, but they have many questions. Sometimes they have some superficial, not so important feelings like itching, like having dandruffs, sometimes some pimples, of course, during the hair regrowth process. They have such simple but expected problems or questions. They can reach us easily. We have amazing follow-up setup, you know, and all patients can reach in few hours to our clinic, and they can get the answer they need about everything. But it's not enough. Doing this operation in Turkey, in our clinic in Istanbul, and of course checking people via email or WhatsApp photos, it's not enough. Another important point in this field, of course, to service people coming to your countries and checking you in person, face to face. Why? First of all, we have some patients, they have some concern about process, procedure, follow-up, or methods or results. Of course, they have some concern. It's normal, of course. We are coming here and we are making plans, operation plans on their head, not on the photos, you know. And of course, we are trying to make them relax. Of course, we are trying to inform them much more properly. Some patients, of course, after the operation, they want to see me in person. They want to ask some question in person. That's why for long years, maybe for more than 10 years, I've been going to the different countries, including in the United States, Qatar, Dubai, Italy, Spain, Portugal, Brazil, a lot of countries I have been before. And this is the second time in Germany, in Berlin. In time, of course, we have more patients from Germany. First of all, we want to show all people are different. We want to express this difference. We are getting much more better, and we are making a lot of innovation, and of course we want to show people all these improvements, and we want the people, everyone interested in the hair transplant, to compare this quality. They should achieve our quality, our standards, our results easily, and then I think they should compare this quality, this standards, this result with others. And I want everybody to see the difference. And of course, I want everybody to feel confident in this way. But one important part of all this process, sometimes visiting doctor in person or seeing doctor in person. They cannot come to Turkey often, but we can come here. This is our work, and we started to do these visits in the different countries long time ago, and we are planning to come Germany, not only Berlin, to the different cities, München, Frankfurt, Düsseldorf, Köln. Every 2–3 months, we are planning to come, and we are planning to see our new or old patients. And in this way, we are trying to help people.